Welcome back to On the Beat, everyone. I'm over here with Dr. Andy Barlow from Regenerative Medicine of Mississippi. I'm so excited to bring this conversation to you. Why? It's all about stem cell. It is the future of medicine. I can't wait to talk about it. How are you, my friend?
Great, Troy, and thanks for having me here.
You just heard me say, I love this conversation. I've been to many other states and been bragging about you and what you do. Let's talk a little bit about what stem cells are and where they come from to begin with.
Okay, well, that's a great question. And where stem cells, where they come from, is actually the type of stem cells we use comes from the umbilical cord.
Yes.
And inside the umbilical cord is there's a part of that called Wharton's jelly.
Yes.
And the Wharton's jelly has what is called mesenchymal cells. And I think I heard somebody say that earlier today. So anyway, it's a very tough word to name or say, but the stem cell that we use comes from mesenchymal cells from the umbilical cord.
All right.
Now, then these stem cells that we use, these mesenchymal cells, we actually can inject those into the knee, shoulder, or hip. And it actually helps regenerate, not just get people out of pain, but regenerate and restore damaged and unhealthy tissue.
Okay, well, you say restore and repair. What are the benefits? Now, I want you to break that down so everyone at home can understand in layman's terms.
Okay, well, one thing, the first benefit is that it helps people get out of pain. And that's usually beneficial. But also with these proteins that are in the mesenchymal cells and the growth factors, it actually allows the tissues to grow, rebuild, regenerate, and actually give it structural stability so that the cells can actually maintain integrity and health.
Okay, well, we put a question out to some of our viewers and they message us back on Facebook, and here's one of them for you, because I think it's a conversation that we're going to get a lot of traction on this and people are going to have a lot of questions for you. If I've taken a steroid shot, which is an interesting question, can I be a candidate for stem cell therapy?
And that's a really good question, and the answer is yes and no. Okay. No is if you've had the steroid injection within 3 weeks.
Okay.
So after that 3-week window, then a person can be a potential candidate for stem cell therapy.
All right. Well, once we have the stem cell therapy, how long before I see some sort of pain relief or fixing the issue?
Okay, and every patient is different, but typically it's between 4 to 6 weeks because this regenerative process is going on in the body, and it takes about 4 to 6 weeks before most people start to see improvements in their health.
Okay, well, this next viewer obviously knows what they're talking about because it says, what factors can slow down the regenerative process of stem cell therapy?
That's a really, really good question, and there's 4 main processes that can slow down the regenerative processes of stem cell therapy. Number 1 is if a person is a smoker. Okay, because stem cells need oxygen to proliferate and to grow. So if a person is a smoker, it doesn't mean you're not a candidate. Just realize that the process of healing is going to be slower.
Now, I think that's with most healing, isn't it? If you are a smoker.
Yeah, across the board, it would be a slower process in healing. Number 2 is if a person is a diabetic. The reason for this is stem cells have like a homing mechanism, and what they home in on is inflammation. Okay. Most people, when they have pain, that's associated with inflammation. Diabetes is systemic. It means inflammation can be throughout the whole body. So you put the stem cells in, and they can get a little bit confused as to where to go because of the overall body's inflammation. So smoking, diabetes. If you're morbidly obese and a person wants injections below the belly button, the reason for that is every time you take a step, you actually transmit 3 times your body weight from your ankle, knee, hip. And if someone is morbidly obese, you're multiplying that extra weight 3 times, and every step is just pounding the ground.
I got you.
And then number 4 is if a person is a chronic pill popper, meaning if they're taking Tylenol, ibuprofen, aspirin, again, because stem cells home in on inflammation, and when you're taking those anti-inflammatories, the stem cells don't know where to go.
Well, again, thank you. Great information. I really appreciate it. Guys, if you want to find out more, there it all is up on the screen for you. Regenerative Medicine of Mississippi. Dr. Andy Barlow is the man to see to ease that pain. Back up to this short break, everyone. You're watching On the Beat.